stem cell transplantation for AL amyloidosis has been used for approximately 25 years. Until now, I think we have seen an increase to some extent in the use of stem cell transplantation for AL amyloidosis, given the fact that it was the best therapy in terms of outcomes in very selected patients for this procedure. However, this has been challenged recently with the advance of more effective therapies that are non-stem cell transplant for AL amyloidosis. We have the bortezomib-based therapies, and more recently the daratumumab, which kind of had a mini revolution for patients with AL amyloidosis, because we can achieve a very deep responses with a relatively easy therapy without the need to commit them to stem cell transplantation. So I believe that we are seeing more and more patients that are actually achieving a deep response, preferably a complete response, and after which, even if they are eligible for stem cell transplantation, we will, here at Mayo Clinic, we will collect them, collect their stem cells, store them, and will not proceed with autologous stem cell transplantation. And I think that the major issue is obviously the risk of death in patients with AL amyloidosis. It did come down over the years with a better selection of patients, but still remains a major issue. So practically, I believe that the use of stem cell transplantation will decrease over time, maybe use not upfront as being used today, but at the later stages of the disease, when the disease will eventually relapse. However, several things I think should be considered if a patient to proceed or not with stem cell transplantation. First, if a patient has a renal disease only, it does have only renal amyloidosis, then the risk of death is actually quite minimal. And since stem cell transplantation until now is the only therapy or major therapy that can actually lead to a long-term survival, then those patients still need to be considered for this treatment modality. The second patient population is those patients that have a more myeloma component in their disease, such as a high plasma cell burden, if they have a high-risk FISH, or if they are relatively young and did not achieve a complete response with standard intensity therapies, one should consider the option of autologous stem cell transplantation. And we definitely see those patients from time to time. I believe these are the two major issues that still patients can be considered for autologous stem cell transplantation, despite that they achieve a good response to initial therapy with a non-transplant approach. As far as the management of complications with stem cell transplantation, obviously this is mainly in the patients with cardiac disease, especially if the cardiac disease is quite severe. We see multiple complications with these patients, such as worsening heart failure during collection or transplant, such as arrhythmias, including lethal arrhythmias, such as increase in volume overload during the procedure, worsening kidney function, and sometimes even the need to go on dialysis either temporarily or permanently. Obviously, sepsis that can be quite challenging if the patient has a restricted organ function. And some patients will have bleeding complications due to the organ involvement, such as GI bleeding. All these are sometimes can be anticipated, sometimes cannot, and are best managed in a setting where autologous stem cell transplantation for these patients is done routinely. So the team is first aware of those complications, and we have a group of physicians from multiple disciplines that can address those issues. patients with stem cell transplant with AL amyloidosis undergoing stem cell transplantation are more likely to be inpatient. Here in Rochester, we do the procedure as an outpatient and admit only for if a patient has a major complication or for safety reasons, and those patients are definitely more in need for hospitalization to manage their various complications. Selection of patients to this procedure is paramount to a successful of the procedure. I think that we have become slightly more restrictive, given the fact that patients can achieve good responses for the most part with the standard intensity therapies. So a key success for transplantation in AL amyloidosis is having the transplant in a center that has large volume of patients undergoing stem cell transplantation for this disease.